Atrium Health's commitment to quality is more than a decade journey. Carolinas Rehabilitation has been with us along that entire journey and is an integral part of our system of care. As a healthcare system, the quality of what we deliver has to be of utmost importance and in the forefront.
I think everybody would say the culture is in their people, but we would take that a little step further and talk about really the behaviors of our team. And really there's an intensity that is focused on the patients and families when they come to Carolinas Rehab that's really unmatched. We have patients that come from all over. They're really in a very bad spot. They've had some life-altering injury or disease process, so we really have to be on our A game every single day. We've always been advocates for those that have different types of abilities and disabilities, whether they're physical or developmental. So it's really built in the DNA of our organization. This is a place that you not only come to get great care, but it's a place of healing, not only physically, but emotionally and spiritually. And that's really what has put us in the forefront of quality.
It doesn't matter if you're a caregiver, a provider, a nurse, a non-clinical caregiver, or someone who's working in front office operations or back office operations. It really begins with you. It's all of our responsibility. We all strive to keep patients safe each day and do the things that we're here to provide.
It's been a little over 8 years since I came here from the neuro ICU across the street. I had a very rare spinal stroke and infarct. The key thing here at the Carolinas Rehabilitation is that I was teamed up with a very gifted doctor, Dr. Latanya Lofton, and she understood that sometimes the care plan has to be adjusted to fit what the needs of the patient are.
Over the course of that 1 month here in acute rehab, he actually began to develop some improvement in his strength. That is unusual for the type of injury that he has. Most people who sustain an injury like this, it usually takes upwards of 6 months to an even year before we are seeing this sort of recovery. But when he left us, he actually was using the Locomat to help stand and take some steps. So it was really a remarkable recovery from the beginning. When I think of quality care, I think about giving each patient 100% of what we have. We want to give the best care to every patient at every visit, every encounter, every opportunity that we have. We want to see every patient have the best possible outcome that they can have. We recognize that in rehab, not every patient is going to walk again. Not every patient is going to recover from the injury that they have. But that doesn't mean that they can't have a great outcome. They can still have a great life. We believe that there is life beyond these walls in rehab, and it starts with us. So we want to give them the best foundation that they can have so that as they move out into their life and into their communities, they can be more active and they can be better than they were when they first entered our halls.
Carolinas Rehabilitation is a place that cares. We've got some very gifted doctors and physical therapists, occupational therapists, recreational therapists that truly care about the patient. And that gives you the confidence to deal with what you're going through.